So we find that the Depo injectable shot works really well for people who are just starting to use contraception because it's really easy administration. You don't have to remember to take something every day, and you don't have to have a procedure in the office. Hello everyone, my name is Dr. Nicole Sparks and I'm an OBGYN. Today I'm here with In the Know and we are going to be talking about the Depo injectable shot. The Depo-Provera injectable shot is an example of a hormonal birth control. It does contain a form of progesterone inside of it. Well, usually you will get the device from your pharmacy, and either the pharmacy can administer it or we can actually administer it for you in the office depending on your provider. And remember that Depo is a shot, so just like any other shot, you might have some pain right at the time of administration and maybe some discomfort for the next day or two, but that will quickly go away. It's very effective if you actually get it at the right time every 3 months. The only time it's not effective is when you actually miss your next shot. So usually when people get pregnant, it's because they're not getting their shots on time. So make sure that you're going every 12 to 13 weeks to get your shots at the time you're supposed to be getting them. So that's only 4 times a year. If you have heavy periods or really painful periods, it works really well for that. And the Depo injectable shot can actually decrease your risk over time of endometrial cancer. You do have to remember to come in every 3 months to get your shot. Also, some users may notice some weight gain. So if you already have issues with gaining weight, I actually would not recommend the Depo for you. Another downside that we see a lot of users complain about with Depo is irregular spotting. So usually when you first start this, similar to all of the other hormonal contraception, you will notice that you may have some unscheduled bleeding, which some people really don't like. About 50% of people will actually have no bleeding by the year mark when you're taking Depo. So if you're okay with having no periods, then the Depo may actually be good for you. For the Depo-Provera shot, there is a slower return of fertility. So if you're someone who's trying to get pregnant, I would actually get off of the Depo sooner than later. We've seen that it takes as long as 12 to 18 months for some people to get pregnant after they get off the Depo shot. But remember that this is not the same for everybody, and some people may get pregnant within just a few months of stopping. Now remember, all of the information provided here is for your medical purposes and information only. If you have specific symptoms or complaints, make sure that you actually talk to your physician so they can figure out the form of contraception is right for you. Thanks for watching today. I hope you guys learned something.